Hi, are you ready?
Yeah.
Shoulder, upper arm palpation. So we're going to go through the list that you've been given for your palpation list. I'm going to start jugular notch. Jugular notch is basically at the top of the manubrium, right where that indentation is, where my thumb is. I'm going to try to palpate everything with my thumb so it's kind of consistent. So right there, jugular notch. I'm going to come to this side. Bicipital groove. So this is obviously the right bicep. Bicipital groove is also called the intertrabecular groove. And it basically, sometimes what you can do is kind of relax the elbow and try to sort of like internally rotate and externally rotate. But you're going to go kind of between where the bicep tendon, the long head of the bicep tendon would kind of insert. Right here, like lateral to your coracoid process, is going to be your bicipital groove, where your bicep tendon, origin tendon originates and comes through. Sternoclavicular joint is right here beside the manubrium. What I like to do is actually horizontally abduct and adduct the arm, and you'll feel the SC joint or sternoclavicular joint like push into your hand there. So I'm trying to do it with my thumb again. So we're going right there. Thumb or two fingers will be my palpation. We're going to go humeral shaft, pretty simple. It's here. Obviously, you're not going to palpate just the biceps, but the humeral shaft of the bone, I usually go lateral to the bone, and I go to the mid shaft of the humerus. Clavicle shaft, pretty simple. Go to the mid section of the clavicle, right here. Right here. Pec major and minor. So pec major is obviously the big superficial pec muscle right here that inserts into a lot of your ribs. Pec minor, I always go from like the coracoid process, which is kind of right where your short head of your bicep tendon originates to. So slightly medial below your clavicle. Here, that's where your pec minor starts, and then it inserts into third and fifth rib. So I kind of follow it down in this diagonal groove with my fingers, and that would be your pec minor, which is deep to your pec major. Acromion process, right here. Acromion process, tip of the shoulder. AC joint, acromioclavicular joint, just slightly medial to that, where the clavicle hits into the acromion. So I'm gonna roll up again, sorry. Coracoid process, I just went to that. So we're going AC joint, we're going slightly down, slightly medial. It's kind of uncomfortable for them. If I kind of push on it, you can feel this bump here. Feels maybe a little bit uncomfortable for some people. Humeral head, right to below the GH, glenohumeral joint. We're gonna find the humeral head right here. Greater and lesser tuberosity. So the way I would palpate the greater tuberosity, which is on the lateral side of the humeral head, is I would internally rotate the arm, and I would have my fingers right around the humeral head, and as we internally rotate, we're gonna feel the humeral head the greater tuberosity come forward towards us. So we internally rotate, then we externally rotate, and the lesser tuberosity is gonna come out. So lesser tuberosity is on the medial side of the humeral head, greater tuberosity is on the lateral side of the humeral head, like that. Deltoid muscle right here, anterior deltoid, mid deltoid, posterior deltoid right here. Biceps brachii, long head comes down the lateral part of the biceps, short head goes down from the coracoid process through here. Spine of the scapula, so I'm going to have Nathan stand up and turn around. And a little hard to see through the t-shirt, but we're going to kind of go with it. So spine of the scapula is obviously the big palpable bump that comes from your acromion all the way down diagonally. You feel this big obvious bone here, protrusion, spine of the scapula. Teres major is if you go to the inferior angle of the scapula. Teres major literally is the first rotator cuff muscle at the base of your inferior angle. So teres major, you work your way up. Teres minor, work your way up to where the spine of the scapula is, right below it, infraspinatus. Right above the spine of the scapula, supraspinatus, like that. Those are all your rotator cuff muscles that you guys should know well. Superior angle of the scap is going to be, find the spine of the scapula, go to the end of it, superior angle. Sometimes I actually bend their arm behind their back, like kind of like this, so it kind of protrudes the scapula out a little bit, and I can find the superior angle right there at the top, and the inferior angle is right here at the bottom. Axillary border is the lateral border of the scapula, here. Medial border or vertebral border is right here. Rhomboid major is deep to the trapezius muscle through here. Rhomboid minor is higher through here. Levator scapula is from the superior angle of your scapula towards your cervical spine here. So sometimes we'll actually like drop the head just so we can get it to protrude out a little bit more, like that. Latissimus dorsi is going to be like big muscle, right? Big muscle, all lateral here. So we're going to come through, pretty easy to palpate. Trapezius upper section, middle, lower, right? Traps. So we've got upper, middle, lower. Rotator cuff just went through, AC joint went through, CC joint. As we're on the back, triceps brachii right here. So we've got the lateral head of the triceps, long head of the triceps, medial head of the triceps right here. Spine and scapula we did. Okay, I'm going to flip for the other ones. Coracoclavicular joint, pretty simple. Find the coracoid process, go up to the clavicle. That's where your conoid and trapezoid ligaments are. Coracobrachialis is deep to your short head of your bicep. So usually what I would do is externally rotate passively, like relax them. Find the short head of the biceps and go deep to that, deep here. It's going to be deep. Coracoid brachialis. Brachialis muscle, which is the one that I was just reviewing myself, is I would have them sort of pronate passively, so the biceps is kind of taken out of the equation and it isolates the brachialis. But brachialis is deep to the distal biceps, so you're going to go either side here of the distal biceps and you're going to kind of palpate through here. As you kind of go into flexion, extension, you're going to feel it kind of protrude into your hands a little bit more. Manubrium right here. And scapulothoracic joint. Scapulothoracic and subscapularis muscle right here. So it's where the scapula hits into the rib cage. So you need to either lie them down or raise the arm up and get deep to their lats, into the axillary border kind of thing, or axillary area, and you're going to hit the scapulothoracic area, but also the subscapularis muscle, which sits on the front of the scapula. And I think we are done. How long is that?